Good afternoon and welcome back to our monthly Facebook Live series. And today we are going to be talking about joint replacement revisions. This is Dr. Brian Perkinson, one of our total joint surgeons. Dr. Perkinson, tell us a little bit about yourself.
Hello, thanks everybody for joining us today. My name is Brian Perkinson. For those of you who don't know me, I'm a Franklin native.
Is there a unicorn?
I'm the unicorn.
Mm-hmm.
I grew up here, went through the Franklin school system where my mother was a teacher, went to Battleground Academy, graduated in '96, went to the University of Tennessee, studied biomedical engineering, went back to med school and went into orthopedic surgery. And then studied at the Campbell Clinic, which is one of the top residencies in the country. And then did a year fellowship at the Anderson Orthopedic Institute, which is where I focused on joint replacement and brought me here to subspecialize in joint replacement.
Awesome. Well, thanks for spending some time with us. Sorry to cut you off there.
No worries.
So today we're talking about joint replacement, specifically the revision part. So in hip and knee. But first, let's kind of back up. Talk to us about hip and knee replacement.
Yeah, sure. So hip and knee replacement. What we're talking about, let's get real granular and go down to like what a joint is. Mm-hmm. So a joint is where your two bones come together mm-hmm. and have the ability to move or articulate. Mm-hmm. But in doing so, they rub against each other. Okay. And so there's a substance called articular cartilage mm-hmm. that exists on the end of the bones. Okay. And that is basically your tires on your car. Okay. Well, that doesn't have really great natural healing properties. Mm-hmm. So over time it wears. And eventually it gets to a point where it wears fully, and we call that bone-on-bone arthritis. Okay. And that is the most common thing that we use joint replacements for. Okay. It is osteoarthritis by definition. Mm-hmm. Okay. And so what we do in a joint replacement is we essentially resurface the end of the bones with various metals, plastics, ceramics mm-hmm. in order to recreate your joint in hopefully what is a pain-free environment. Okay.
So you have a joint replacement. Sometimes you have to replace it again, also called a revision. Talk to us about that, about how often and why you would potentially have to do that.
So first of all, I want to highlight what you said, which is what we're referring to as the word revision. So mm-hmm. when you hear the word revision, it means we are doing some type of a joint replacement again. Mm-hmm. And the first thing to say is that joint replacement works extremely mm-hmm. well. Absolutely. And the revision rates are very low. Mm-hmm. And so hip and knee replacement surgery will now last greater than 20 years, 95+% of the time. Mm-hmm. However, in the United States, we're doing over 750,000 knee replacements a year, mm-hmm. over 500,000 hip replacements a year. So when you look at those numbers, there's going to be a percentage of people who have problems. Mm-hmm. And why we wanted to do this Facebook Live is we wanted to educate people to what that means and mm-hmm. when that could happen and what they should be looking for.
Mm-hmm. Absolutely.
In particular, what we want to do is offer our services to people who have existing joint replacements mm-hmm. that they find that hurt. Okay. And kind of say, hey, if you haven't seen someone, mm-hmm. or at least if you haven't seen a fellowship-trained joint replacement specialist who mm-hmm. focuses in revision work, correct, which is what I do,
absolutely,
then you might be missing an opportunity to have some relief.
Okay. What types of issues could cause the need for a revision?
So there's a lot of things that happen acutely to mm-hmm. which you would know, right? So people can fall and have a fracture. Correct. People can develop an acute infection. Mm-hmm. If it's a hip replacement could technically come out of socket. That's called a dislocation. Okay. And when those things happen, the people are very aware of them. Mm-hmm. And they say, I have a problem, I go to an ER, I go to an orthopedic surgeon, I get this addressed. But there are things that can happen where you're having chronic pain mm-hmm. and you just don't know why it's occurring or where it's coming from. And this can occur inside the joint replacement itself mm-hmm. or it can be external to it, to the tissues around it. Okay. Because even though you may replace your hip or your knee, mm-hmm. all of your tendons, your ligaments, the soft tissues around your knee can mm-hmm. still have issues even if your joint's functioning well. So the question becomes, well, when does a joint not function well? Okay. And a hip replacement example would be the devices can loosen away mm-hmm. from the bone or not fully ingrow into mm-hmm. the bone. And so the devices in general are either cemented in or they have a porous metal coating and the bone grows into them. Okay. And they can over time loosen. Okay. And they can loosen on either side. If we're talking about the hip, they can loosen in the pelvis or the femur. Okay. If you're talking about the knee, we're talking about loosening on the femur or the tibia. Mm-hmm. So that's one of the main reasons that you may need to do something. Okay. Second is the plastic can wear out or have plastic damage, which mm-hmm. is the bearing surface that you use. Okay. Third are things like chronic smoldering infections that you may be unaware of. Okay. And that can happen without you having a severely red knee or a severely red hip. Again, it's a rare phenomenon, but we catch those. Other things, like we were talking about earlier, is metal reactions. Right. Not so. I know you've had a family member.
Yes, my dad. Yeah.
So I'm taking care of Lindsay's dad, and what we found in Lindsay's dad's hip is that he was having metal debris issues, and so we actually changed that. We changed the bearing surface so that we changed it to a ceramic on plastic so that we could get rid of the metal debris.
Yep.
It got rid of the cobalt chromium that was irritating his hip, and we were able to get him fixed up.
Perfect. And now he's an extremely active person and loving life. Yep. So thank you.
Yeah, he's doing great.
So when a patient comes into the office with just this lingering pain from a replacement, are there any things to try non-surgically first, or what step would you do first before heading into surgery?
Yeah, so great question. So the answer is yes, but before that, what you want to do in revision surgery is you want to make a diagnosis. And so we start by doing a workup. And the workup varies depending on whether it's a hip or a knee. But the workup will include things like blood work. Okay. Sometimes we'll draw fluid out of the joint to test for things that could be occurring in the joint. We'll get various x-rays. Oftentimes we'll get advanced imaging, whether that's a CT scan or an MRI, occasionally a bone scan. Okay. And so then we get back together and we look at all this. And basically from that, I tell people that, and this portion of it is detective work. I'm just trying to figure out what went wrong, what went wrong, why this is bothering you, and what we can do to help. Okay. And then based on what we find, there are surgical and non-surgical options. Okay. But it's not like the first time you do a knee where we say, hey, we're going to do all these non-surgical options, and you're going to have to fail that before we do a joint replacement. Right. In this scenario, I may find a problem where a non-surgical option is going to provide no benefit. Right. And I say, hey, it's up to you. Do you want to live with this, or do you want me to fix this? I have found this problem. What would you like to do? Right. And so in that scenario, it's often surgical. If we find that it's something that we can live with, and it's some type of external pain, pain coming from another source into your knee or into your hip, such as tendon tears, tendinopathies. Sometimes it's systemic. Sometimes we'll make the diagnosis of a rheumatologic type disease. Other things like that. Then we will treat that non-surgically. Okay. So talk us through the basics of a revision. I know that every surgery is different. You personalize your surgery for each patient, but talk about exactly what is a revision, or what do you replace? So it's not dramatically different than a standard knee or hip replacement. It's a little bigger surgery. It requires a little more skill set from your surgeon side who does revision work. So if you need a revision, you want to make sure you're going to a surgeon that provides revisions and does it on a routine basis. And so, but then the surgery itself, it's a standard knee incision that may be increased slightly, and very similar on the hip side. Okay. But it really does depend on the extent of the surgery, because what we do in a revision surgery is we fix the problem we've discovered. Okay. So let's say a hip surgery, for example, we might have discovered that the cup had not ingrown and you're having pain because you're walking on a cup that's really not well fixed. Right. In that scenario, if the femoral stem is doing well, we leave that alone. Yeah, don't touch it. We take out the cup, we fix the cup, we change the bearing surface. That's all we do. We leave the femoral side alone. Okay. And the knee replacement, it's a little higher probability that we redo the entire knee. Okay. Because the knee has to be balanced in a way that where once you change one of the devices, the position of the other device matters relative to each other. Sometimes we can just change one. We can just say, hey, we're going to change this plastic bearing. Right. We're going to change your femur or your tibia. Okay. But often you end up changing both. Okay. And the main principle is you're going to reconstruct a healthier bone. Okay. And so you're going to put new devices in that go deeper into the bones to grab better bone quality. Because the bone quality at the surface, the interface between the metal and the bone, over time usually is not high enough quality to just use that portion. So you have to go into better quality bone. Okay. Recovery-wise, is a knee versus hip, and I'm thinking physical therapy and kind of the after, does it differ dramatically from the standard hip replacement and knee replacement? It actually doesn't dramatically differ. Okay. With hips, we do some therapy, but we don't require a lot of therapy with hips. Sometimes with hips, depending on the type of surgery that you have, you may have some restrictions after surgery where we don't want you to bend too deep or cross your legs. And that's to maintain the stability of the hip until everything heals. On the knee side, yes, therapy is important on the knee side, and pretty much we will get you into therapy, and you'll be doing 4 to 6 weeks of therapy. But oftentimes in people who've been living with chronic pain from a joint replacement, if we find a problem, it's impressive how quickly they get better, because they've been living with this difficult problem, and then you relieve it pretty quickly. And yes, you have to heal the surgical pain, but now when you're standing, you're feeling a more solid construct in your knee or your hip. And so if we do find a problem, it's generally a very successful procedure.
Awesome. Well, Dr. Perkinson, thank you so much for your time today, and kind of helping ease hopefully the minds of someone that may be going through this pain. Before we end, talk to me a little bit about the comprehensiveness of Bone and Joint and kind of what all we offer here at Bone and Joint, and then also in the community.
So I think Bone and Joint is a unique place. Our affiliation with the hospital is a strong one. Williams Medical Center is a wonderful facility. Our facilities here are top notch. You're not going to get a better building, particularly with better people in it, than you get here. And then when you come here, you have all ranges of orthopedic subspecialty, surgical as well as non-surgical. You have non-operative sports medicine doctors. We have entire physiatry suites with Dr. Cow. We have in-house physical therapy, which is an amazing group of people and an amazing facility. Occupational therapy, we have in-house imaging, CT, of course, X-ray, but CT and MRI. We have a full downstairs A to C, that is, which is our ambulatory surgery center, where you can come in and have surgery and leave that day, which is top notch. And then, as you mentioned, in the community, you know, we have things through our ATCs, or athletic trainers, that are at every high school in the county, as well as we have now 5 urgent cares.
It will be 6 locations.
Soon to be 6 locations. Coming to a location near you. So our community outreach with our urgent cares, where you can stop in, have high quality diagnostics, and then if you need us or have a problem, that person will get you to the correct doctor. I just don't think you're going to find better care in other areas.
I 100% agree with you.
So the one thing I would like to leave you about joint replacement is, if you do have a painful hip or knee replacement and you have not been given a good reason for why that's occurring, I recommend you come let us take a look at it.
Absolutely. Well, thank you so much, Dr. Perkinson. Appreciate your time today. If you have any questions for us or want to schedule an appointment with Dr. Perkinson, you can visit our website at boneandjointtn.org or give us a call at 615-791-2630. Thank you again for your time. Appreciate it.
Thank you, Lindsay. I appreciate it.